Ending on that point there, that's, again, very simple. When there's one supplier, the price is going to go up. We're nudging the industry with this conversation, and I'm hopeful, like I said earlier, that they're going to get the message and help us out. Let's assume we get the industry to be transparent and competitive. That's a big assumption. I want to turn to where we ended up a while ago, the consumer. In my own plan, when I took this on 11 years ago, it was an atrophied healthcare consumer that would have described my average employee. They, of course, were concerned about their premium contribution staying low. That's the really only thing out of pocket if you take care of yourself. But when I tried to tell them that I need you to help me do some of the heavy lifting, there's no market that works well, even when it's transparent and competitive on the supply provider side, if you don't have an engaged consumer. Look how often you see people at the grocery store looking at their phone to save 20 cents on a $2 item. We do not have that currently in healthcare. I created an atmosphere to where I told them I would hold their costs down in the future, which was an idea. I couldn't guarantee it, but I did it. I had to change the behavior to get my employees, healthcare customers eventually engaged. Do you think that's possible when healthcare has been so paternalistic, whether it's through Medicare, Medicaid, or employer-provided plans, where most individuals are only interested in how low their copay is to avoid any skin in the game? I fixed it, and it's worked. Do you think we can get the other side of the equation involved? That's the individual that uses health care to help transparency out if, in fact, we get it. Anyone that wants to comment on it?
Senator, I can start for sure. I'm really excited to hear about your personal story of leadership within the commercial enterprise or business in terms of how to approach this together with employees. And I lament really that we put you in a situation where you had to find your way to that. And so many employers I think we hear from feel like they're struggling, swimming upstream against a system that is designed to make it harder and harder for them to get a better deal for their employees, and yet the employees rely on them for that health care. To answer your question, I think just very directly, not only is it possible, it is necessary, and I believe ultimately inevitable, that ultimately what we're talking about here, and this is why our strategy just fundamentally relies on consumers and patients. What we're talking about are people making decisions for their own health care. They're the ones that are ultimately going to end up in the hospital or not be in the hospital or shorten their life or spend time being able to spend time with their loved ones or not. And so as we empower them, I have absolute faith that people want to live healthier lives, they want to live better lives, they want to live longer lives, and even sometimes if they are going to make some trade-offs, they feel that they need to be in control. And when we give people that information, when we give them a taste and an ability to make those decisions for themselves, I think we're all going to have to run to get out of the way because they're going to be checking their phones and doing everything else in healthcare and demanding really the kinds of accountability and choice that they're accustomed to in the rest of the economy. All we need to do is really start getting out of their way.
It's what we did in my company, Dr. Woodcock.
We have proposed reform in our self-care part of drugs, which is the over-the-counter. We regulate maybe 100,000 different drugs that are offered to consumers for self-care, but that whole system is stuck in the 1970s, and we can't have any innovation within that monograph system. I think, as a physician, I would say I think there's a generational issue here. My older patients often wanted the doctor knows best, okay? But the rising generations really want to be active participants, and there's no better way to for more minor conditions or certain conditions than to actually have safe and effective drugs available to you over the counter. You don't have to take off work, you don't have to make a doctor's appointment, you don't have to pay for parking, and you can select amongst options. But that has to be done so that it's safe and effective for the person to use that product. So we're very dedicated to self-care and the rising self-care industry, and we believe that the OTC reform, and Senator Casey, thank you for your leadership, we believe that will help bring that about.
Ms. Robinson, would you want to comment quickly?
Yes, I don't know that we have a view on your exact question, but I will say that in the Inspector General's office, we know we need to be prepared to oversee a healthcare system that is going to be more technologically driven, more consumer driven. It is going to be much more in that vein. And so we are preparing to be ready to oversee that kind of healthcare system.
And thank you. I know from my own experiment, when you own your own well-being, when you have skin in the game, and you make tools available that are like pulling teeth to get available, it can work. You know, we've done it now 10 years running, so thank you for your comments.
Thank you, Senator.